Before the current pandemic hit, an epidemic was already well and truly underway here, the opioids crisis. For several years now, it's reached into every corner of this province. And with services stretched thinner by the day due to COVID-19, it's putting pressure where there was already no more capacity to give. Northern Ontario is a case in point. With us now for more, in Timmins, Ontario, Mark Leonello. He is Program Manager for the Canadian Mental Health Association, Cochrane-Temiskaming. In On Deck, Omniconning First Nation on Manitoulin Island, Anne-Marie Thibault. She is Clinical Director for the Gwek-Wadzewin Mikan Youth Mental Health and Addictions Program. In Sudbury, Ontario, Joel Boivin, Registered Nurse and Outreach Worker for the Sudbury Action Centre for Youth, and Marion Marr, Professor and Course Co-Chair of Northern and Rural Health at the Northern Ontario School of Medicine. And we're really grateful that all of you could spare some time for us on TVO tonight to discuss what is really a very troubling set of circumstances. And I want to start by just putting a few facts on the record to share with, well, you know them all too well, but to share with our viewers. So Sheldon, bring this graphic up if you would. Thank you. Opioid deaths in Ontario. 1,500 people died last year from an opioid-related cause in this province. And early reports from March to May show that opioid deaths are up 25% compared to last year. Deaths in Ontario from opioids have been rising every year since 2011, with big increases each year since 2016. And last year, 2019, death rates were more than double in Northern Ontario compared to Southern Ontario. And Marion, I think we have to start there. Why is there such a big contrast in the death rate between Northern Ontario and the rest of the province?
So there's probably a lot of reasons. One of the major ones is, of course, that we don't have the same ability to connect patients or clients with a continuum of care. A lot of times, you know, if you're in Southern Ontario, the services might be a few blocks away or maybe just in the next town. A lot of times here, they might be hundreds of kilometers away. So a lot of times, even people who are wanting to go get into treatment, they may not have the support systems available to them in order to, you know, check themselves into treatment. And I think particularly this is true for women with children, and you know, who don't maybe have people to look after their children during that time, and who would prefer not to you know, rely on others to look after their children. Maybe they don't have safe areas or safe connections to look after their children. And also for people who are still using, actually, this is really difficult for them to get into treatment.
Okay, Mark, let me go up to you in Northeastern Ontario, and maybe you could tell us, how have you seen the opioid crisis progress in the time that you've been in your field?
Well, you know, I've been in the field about 24 years and involved in the last number of years with housing, justice support services, and concurrent disorders, which is mental health and addictions. And I can say strongly with a lot of confidence, especially in the last 5 years, the difficulty in terms of the cases that we're looking at supporting have increased, not only with the numbers, but the complexity of the cases with the, you know, addition not only of opiates, but of things like speed and meth. And increasingly difficult to be able to support these individuals. You know, there was a term I had heard yesterday or this morning describing it as a vortex with addictions, mental health, trauma, severe trauma for a lot of the folks involved in the justice system. It really makes a very difficult quagmire in terms of trying to piece it out and trying to be able to support people adequately.
Joel, same question to you. How have you seen this issue progress in the time that you've been in nursing in Sudbury?
So I've been doing this for about 12 years. I actually started a little bit before finishing my nursing training, and I've really seen things change in Sudbury for the last little while. So in starting this work, it was actually human medication that a lot of people were taking. So as things progressed, particularly 2016, that's when we started seeing fentanyl as a mainstay, and often mixed substances with various forms of speed and other carfentanyls. The other thing I've really noticed over the last 4 years, too, has been a definite increase in the amount of suffering that people are going through. So for a crisis related to a medication that eases suffering and eases pain, it's something very much related as to what are people finding it helpful for and a relief of in their day-to-day life. You know, a lot of those things like housing, nutrition, those are all aspects that make it a lot easier to stay off of drugs when you have some of those things taken care of.
Joel, can I do a quick follow-up with you here? Does it start then with a prescription gone wrong? Is that how it begins?
So not necessarily so. A lot of times, like even just our prescribing practices, we do have some of a line in the sand as to these are therapeutically acceptable forms of suffering. So physical pain is something that can very easily be able to obtain a prescription for an opiate. That opiate might be relieving that person's physical pain. So at the same time, too, just having quality of diagnosis, because there's a lot of folks out there living with not only severe physical pain, with Sudbury being such a labor town, but we also have to kind of keep in mind that emotional pain, even though we may not be kind of at that point in medicine of having a clear line as to the brain kind of treats many of these aspects the same way, trauma really has an impact. So just as to how the medication themselves are helping people deal with a variety of circumstances around them. COVID has particularly made that worse.
Anne-Marie, as I get you to weigh in on this, and I don't say this with any degree of facetiousness at all, quite the contrary, but Ondek Omnikaning, which is the name of the First Nation that you work with, the short form, I gather, is A-OK. And there's nothing A-OK about the circumstances that you're dealing with. Describe your situation, if you would.
So we're seeing people right across from the province come into our program. We're open for youth from age 19 to 30 across Ontario, both Indigenous and non-Indigenous, and the numbers are certainly rising. And what we're hearing from the participants that are coming to our program are that the access to the opioids are definitely there. We're seeing them come closer to our small communities, especially for those coming from the far north. They're being, transported and brought in as different trafficking happens. So the problem is definitely getting worse, and we're hearing that on the ground here from the participants that come to our program.
And let me follow up with you as well. Given your specialty in Indigenous communities, is there a racial tinge to this story as well that we should know about?
I would say that, when we look at the historical issue of trauma, that is where we are definitely seeing our numbers are higher. There's no doubt about it that trauma is related to addictions, and many of the programs historically have focused on the Band-Aid solutions and are only funded, even though they want to be doing more programming, they're only funded for 30-day programs. We know that in 30 days you can't begin to dive into trauma. So we do consider ourselves fortunate. It's one of the positives of our program is we're able to operate a 90-day program here at Kwakwaka'wakw, along with a 1-year follow-up of live-in aftercare if somebody needs to have a safe and supported environment where they can practice those strategies that they've learned while they're on the land for those 90 days. And then a follow-up to that, the third phase of the program is we're lucky to have a community aftercare program as well that follows those participants through. So trauma is really, the key to that. And when we're looking at the historical impacts of intergenerational trauma amongst families and communities, that is really the core of the addictions when we get down to it. We haven't had anybody come and not delve into trauma when they're here. It doesn't just suddenly appear out of nowhere.
So that multi-generational thing would certainly be, quite distinctive from the situation in the rest of the province. That makes sense.
Very, very much so. When we look at the residential school issues, it's real. I mean, it's real of what people have faced, and we're still only into second and third generation, and still very much feeling the impacts. And of course, it goes along with the other crisis that we see in our communities of low income, unemployment rates, and people just being able to feel good about themselves and being productive. And that's one of the things that we focus on here in the program, which I can get into a little bit later on.
Let me get Marion back in here first. And that is, I'd like you to weigh in, Marion, on the issue that arose yesterday. I gather the makers of Oxycontin pleaded guilty to criminal charges in the U.S. related to the marketing of the painkiller, which was pretty cynically done. And many believe helped start the opioid crisis to begin with. What do you think this portends for the situation in Canada?
mean, it's difficult to know, I think, at this point, because I know the company is also going through bankruptcy. So whether or not we will actually get any money or compensation for families and for victims and so on, that's, I think, is an unknown. At the same time, I think you can't really put a price on that kind of human suffering anyway. So I'm looking really at what can it do in terms of educating people around the stigma that's a lot of times attached to people with addiction. So, as if it was a choice, or, people might just pull themselves up and try a little bit harder, to sort of show that, people don't necessarily at all choose that kind of a life. And, I want to sort of totally support what Anne Marie was saying. I do a lot of long sort of interviews with people with opioid addictions, and I have not really talked to one who chose that, or who doesn't have major childhood trauma. And the childhood trauma definitely is higher in First Nations because of the residential schools and the day schools. However, it's definitely present also in mainstream society. So people have gone through things like childhood sexual abuse, other abuse, through other kinds of trauma. So unless we really deal with that trauma and not just, medicate people or continue to medicate people without providing things like, counseling, things really won't get better. And I'm hoping that, decisions such as that will really support more compassion in society towards people with addictions.
Well, we've talked history. Let's also talk some geography here. And Mark, I'll get you to do that. I don't think that people in the South appreciate how big this province is. And in particular, well, let's put it this way. You're representing Temiskaming, Cochrane-Temiskaming, and the district of Cochrane alone is the size of the country of Greece. And I wonder how do you provide service in such a sparsely populated but massive part of this world?
Very creatively. It is different. It is difficult because of the large geography to be able to do so. So I think that in the North, we've had to be creative in terms of how we provide service, whether it's virtually through telephone or things like Skype, like we're doing today, or whatever. It's kind of forced us to be able to be creative to do this, because you're right, the areas are large, and on top of that, the resources are limited. That we're not like Southern Ontario. We don't have access to things that are around the block, or we're talking about things like homelessness, which is attached to this. It's not as visible in Northern Ontario. We tend to get a lot more of that invisible homelessness where people are either couch surfing or what have you. And so people don't think that it's such an issue. However, it is still there. And, we've had to be able to modify what we do to be able to manage that lack of resources that we often see in Southern Ontario.
Do you have a plane? Like, can you fly into communities?
Well, I was thinking about a helicopter, but no. We don't. I mean, our agency right now has offices in Timmins, Temiskaming Shores, Kirkland Lake, and so lucky enough that we have actually buildings and staff in those areas to be able to branch out from that spot. But even then, I mean, it's still a fairly large area to cover.
So that's the situation on the ground pre-pandemic, and then March 13th came, and and everybody's world changed after that, and then we got the state of emergency, and we are where we are. So, Joel, maybe you could pick up the story from there. How has this story changed post-pandemic?
So it's created a real lack of resources and services within the community. There has been a lot of agencies that have stepped up to try and do what they can with the resources that they have. But at the same time, too, there is no way to introduce policy and protections and precautions without taking some sort of staff resource away. So because of that, people accessing things like food banks, soup kitchens, even just a place to stay out of the rain for a little while has been an increased challenge. In addition to, like, even a lot of the resources that they get from some of these agencies. So things like the amount of food that they get in a day. So currently, our executive director just kind of went out a little bit of a walk, kind of walking a life in the day type thing as she went on her breaks throughout the day, tallied up a kind of receipt of services as to how much a person actually gets. Big highlight of that as to not only just how far someone has to walk to be able to access all these little services that have kind of been satellited out over the pandemic. It's also decreased the amount of quality of services, so things like food. So she added up the calories for the day. It was 8,500 calories that a person would consume in a typical day on the street. So that's over quadruple the typical intake for your average male. But at the same time, too, it's mostly out of fibers and sugars that you won't see most of those calories through the day. And for a lot of folks, the lived experience of this is just feeling constantly, repetitively starving throughout the day. Sugars don't last you very long, and there's not an awful lot of those good fat protein meals that people used to get quite easily through the soup kitchen or elsewhere.
Anne Marie, pick up the story if you would. Since the pandemic hit, how has that changed what you do?
So we are very lucky to be able to, the fact that we're able to be adaptable with our program because of the land base. So we're one of the few treatment programs that were able to stay open during the pandemic, and we've had people with us right throughout. Those that were with us on March 13th were able to complete their program and probably quarantine for the longest because they were in the wilderness for that entire time. So we're very fortunate in that way, but there's no doubt that wait times have become an issue. We've had to change the program from a continuous intake, rolling intake, to a cohort. So we've had to put into place quarantine as well as withdrawal management camps, just to ensure that people weren't coming in with signs and symptoms of COVID-19, and we were able to protect everybody in the program, but also in our communities and on Manitoulin Island, and make sure that we were mitigating that when we had people coming from across Ontario to our program. So that was a big one for us. What we're hearing from the participants themselves is, before getting here, COVID-19 was very difficult for them at home because they're sitting with their feelings. And for people with addictions, that can be the hardest thing to do, and often leads to, to more usage when you have to sit alone with those feelings and you're not able to get out and about to different programs and to distract. So that's definitely one of the negatives that we've seen. And I think we're seeing right across all organizations that service with mental health.
Now, let me just check actually with all of you, because to the best of my knowledge, COVID-19 is obviously a big deal in Toronto, Ottawa, Peel, and York right now, which have gone into modified stage 2. But in the rest of the province, and in particular in Northern Ontario, COVID really hasn't been much of a thing. And I just want to confirm that my understanding of that is in fact accurate. Anne Marie, any cases on the island?
So currently, no, we're very lucky to not have any active cases. We have had some reported cases. I believe the total was 4. I could be wrong on that. I didn't look the numbers up right before, but we've still had to mitigate that and make sure that we're safe. And I think the reason that we don't have the cases is the safety precautions that all of the communities on Manitoulin have put into place. And we've really kind of restricted our travel and tried to offer services outside of the spectrum and be adaptable during this time. Many of us have to travel for doctor's appointments and schooling and different employment. And I think that many people across Manitoulin were able to be creative with that, and just like across the province.
I have to say, I was up there for much of the summer, and the adherence to wearing masks, the following of protocols, the taking it seriously, despite the fact that people were outdoors, I was very impressed. There was a lot of it going on. That was my experience anyway. Marion, how about you in Sudbury? What's the COVID situation there right now?
So, I don't quite know exactly what today's sort of numbers are. They go up and down a little bit, and most of the transmission is still, people traveling as opposed to community acquired. I think, though, for the North in general, one of the risks that's coming up right now is, of course, hunting season, where, in some areas the population almost doubles and people are coming from areas all over Ontario. It used to be the US too, so I don't know if any are coming from the US. So it's that, and actually, like a lot of the travel and recreational use of Northern Ontario is actually something that puts people at risk. And at the same time, we have fewer resources, so that if there is an outbreak, it will be much more difficult to contain and to treat people.
Joel, any cases of COVID in your work?
So not necessarily in my work, as was just mentioned that we have had a few cases that have been more travel related within our work. With a lot of the folks out there, really the time that people were last really getting sick in large mass was more around January. That's when I started to get concerned because we did see a lot of outbreaks happening at the time in China. And just knowing that that's where an awful lot of our fentanyl, if not most of our fentanyl, is coming from, I knew that there wasn't going to be an awful lot of protection for folks out there. So since then, there have been a lot of agencies that stepped up to be able to give masks and gloves and things like that to the population they serve. But even in the early days, it was very difficult to even just be able to attain a mask. So right now, even something as simple as that might impact your ability to access a clinic, to access your pharmacy. So you might actually have to kind of shop around for agencies to be able to find one that has some masks to spare that they can actually give you.
I gather Public Health in Sudbury has just announced 4 active cases in the entire Sudbury region. So that's pretty good. Four cases is pretty good. Mark, how about up in your neck of the woods? Any encounters with COVID?
Well, there's, I think it's the 91st confirmed case in the area, and that's not just in Timmins, but in the general area, including Kapuskasing, Moonbeam, Fouquier, and whatnot. And from what I understand, I think there was another new case reported today. So I'm not sure on the exact numbers, but we've had a few ongoingly.
And how do you, as you look around, how do you gauge the adherence to protocols that you're seeing on COVID-19, maybe particularly among the patients that you would be dealing with?
It's varied. I mean, I can't say that. I think for the most part, in terms of, a lot of people are, at least initially, we would hear from people that there was some concern about what it could mean for them. And that was initially. I honestly, in the last little while, a lot of the clients really haven't discussed it or gone into a lot of detail. Few will wear masks. Others have just kind of gone on with their day and have other concerns.
Joel, what are you seeing in terms of adherence to protocols?
So people have been fairly respectful as to, we have done a soft open of some of our drop-in spaces at this point, so allowing some limited amount of people in at a time. People have been fairly good as far as making sure that their masks are staying on, making sure that they're staying a fair social distance away from each other as well within building. Even approaching at the door, most of the time if somebody has a mask, they'll be wearing it when I answer as well. So things have been not too bad among the population that I serve.
Okay. I guess I want to ask you, all of you now, what do you need? Anne-Marie, what do you need to improve the situation?
It always comes back to the almighty dollar, but I think it's fair to say that funding to offer more treatment beds. Right now, we are funded for age 19 to 30. We work with a lot of different communities across the province, trying to help them get off the ground, doing very similar programming to us. I think our program works during COVID because we're able to be outside. So that part of it is a very big positive with our program, but we're also in the middle of advocating for our younger program to be funded to be open, and that is for 12 to 18-year-olds. We know that addictions are extremely high in that age range, and that goes without saying. We have many calls from 30 and over, so we're just constantly trying to adapt to the needs, and there's only so much money to go around. We could obviously be operating 2 or 3 cohorts at once out in the wilderness and serving 30 people versus 10 if we were able to do that. So I hate to say that because we try to be creative as we can and utilize what we have, but I think there needs to be more beds across Ontario available for people to access treatment programs. I just am looking at our numbers, and we've been operational since 2018. We've had over 286 applicants, and we've only been able to get 102 of those in our door because of spaces. So the hardest part of our job is not working with people with addictions. That just comes naturally. The hardest part is when we have 50 people on our waiting list right now, and we have 10 beds to offer them come January 15th, and having to pick up the phone and tell somebody that's trying to save their life that unfortunately they're going to have to stay on a waiting list for another 3 months. It's absolutely devastating, and there needs to be more treatment beds available across our province, whether it's with us or other programs.
Let me follow up on that. If you've got 50 people who are vying for 10 spaces, what actually happens to the 40 who can't get in?
Well, normally we're able to try to help them to find other available beds, but because of COVID-19, many of the programs have had to close their doors temporarily because of the restrictions that are there. Across the province, we're seeing people just start to get ready to reopen now because of safety protocol. Unfortunately, we did a lot of just referrals that to other agencies that could do Skype meetings, one-to-one telephone meetings, utilizing places like CAMH, which were great. Our local health authorities pitched in to help out. Organizations did what they could, but it still doesn't offer that residential care that sometimes people with severe addictions require just to be able to get out, out of that situation and away from those triggers. And so, that is also where we're seeing rising numbers and a lot of overdoses that have came on the rise lately in the north.
Well, I don't want to be alarmist here, but I do want our viewers and listeners to get an accurate picture of things. Of the 40 who can't get into your program, how many are going to die?
I can't answer that, unfortunately.
Some though, right?
Fortunately, but some of them are. Yeah, we're seeing it happen. We're seeing people in our community. We've had 2 deaths this week alone, and we're very small here on Manitoulin Island and a surrounding community. It's happening every single day. I don't have those exact numbers. I just try to focus on the people that are here and what we can do in working with other programs across the province. But it is happening, and addictions does not discriminate amongst culture.
Joel, healthcare is a provincial responsibility. So I'd like to get your sense of how well, based on how the government is handling the COVID crisis and the opioid crisis, how well do you think they're doing?
Well, it is a difficult it's a difficult comment to make when we do have a premier that did clearly say that people's backyards are more important than people experiencing overdose. That is a quote that can be looked up. At the same time, too, with treatment being one of the many options available, there is also a risk that comes along with it too that I very much see in the field. So for a long time, the people that I seen dying the most were people in a recent period of recovery or reduced use. So that sense of your opiate tolerance can drop back to opiate naive within 2 to 3 days. So within that range, you are very much at risk to some of the extremely potent substances that are on the street versus, say, hydromorphone that you might have found a few years ago. If you bought $10 worth, you may not overdose even being opiate naive. Just as an example, everybody's dose is different. But if you go back to the street now, what you're likely getting is fentanyl, where even $1 or $2 worth of product can end up killing you. So a big part of what I'm seeing right now as the kind of suffering keeps on increasing for folks. So as low-income housing keeps on getting less and less accessible, as basic needs are not being met, to me, that is what is needed to end this suffering crisis that we're in. And in a lot of ways, those aspects I'm just seeing get worse right now. Like for a lot of folks that I know out there, when they're housed, that's all they need. They stop drugs when they are not homeless living on the street. No treatment, absolute cheapest cost, just buy a roof for somebody. Those are your very simple cases that it's just a matter of addressing the needs. And even going to treatment for that person, if you're not lining up some sort of housing, some sort of social supports afterwards, some sort of connection to services, that's all things that puts people back in that exact same suffering that they found so difficult to manage without having some additional support through something like opiates. It's how do we treat just the human life, and how do we treat the human life better in a way that doesn't make opiates appealing to be able to survive it all. As Gandhi put it, by the accident of my birthright. Well, for so many people, it very much was an accident, being born into poverty, being born into low quality housing. These are all factors that nobody really asked for. And at the same time, too, a lot of people are being judged for when they seek their own means of being able to survive it all.
Well said, Joel. Mr. Director, thank you. I was going to ask you for a 4-shot so that I can thank Mark Leonello In the top left corner, Joel Boivin, who is in the top right-hand corner, Anne-Marie Thibault in the bottom left-hand corner, Marion Marr in the bottom right-hand corner. It's really good of all of you to give us a much clearer picture of the circumstances in Northern Ontario for us all tonight here on TVO. Thanks, everybody, and be well.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.